wondered how therapeutic psychedelics help in healing from trauma or even in connecting to spirituality, today I'm going to be sharing my experience with ketamine assisted psychotherapy. And the reason I'm doing so is in hopes that it may help anyone who is fearful of therapeutic psychedelics or to support anyone who is struggling to connect with spirituality after leaving religion like I did. For starters, ketamine is not approved for the purpose of seeking closer spiritual ties or strengthened spiritual life. However, for many people with religious trauma, anxiety can apply, depression, PTSD, even OCD. And these are some of the areas that ketamine is approved to treat. And we'll get into that. This past weekend, I was fortunate enough to have been able to receive a training where I became trained to provide ketamine assisted psychotherapy as a therapist to clients who receive ketamine from their psychiatrist. Part of this training involved receiving ketamine and experiencing it myself. So before I share more of my story on this medicine, let's learn a little bit more about what ketamine even is. Ketamine has historically been used as a dissociative anesthetic and has been used since the 1960s. However, in lower sub-anesthetic doses, ketamine has been proven to be very effective in treating depression and post-traumatic stress disorder. Some studies even show it to be helpful for challenges such as anxiety and OCD, but mainly depression and PTSD are where we see the most benefits. Ketamine works by blocking NMDA receptors in the brain, which affects the release of glutamate, which is a neurotransmitter. This transmitter glutamate plays a role in learning, in memory, and in emotional regulation. So when these receptors are blocked and the release of this neurotransmitter is impacted, it increases neuroplasticity in the brain, meaning that the brain has more capacity to rewire. In other words, it makes it easier for the brain to heal from and release persistent thoughts, behaviors, and tendencies so that we then in turn experience reduced symptoms in depression, PTSD, etc. It makes it easier for us to think differently, in turn learn differently, live differently. Not to mention, these effects can be rapid, often taking effect within hours, whereas antidepressants tend to take a couple weeks to go into effect. As I mentioned, technically ketamine is a dissociative anesthetic. However, it does have similar results as psychedelics, such as impacting our levels of consciousness. It can promote introspection, help us access repressed thoughts or feelings or memories. It can also lead to mystical or spiritual experiences, lead to a sense of unity, or other profound insights leading to emotional breakthroughs or a new perspective on trauma, anxiety, or depression. One's experience on ketamine can differ greatly from another person's experience. And so it's important not to compare or judge yourself. If you are going into ketamine assisted psychotherapy or even psychedelic assisted psychotherapy, if that's something that's legal in your state, there are a few tips I would like to share before going into your journey, which likely your therapist will share with you as well. But this is also info for those who maybe aren't going to use it and just trying to learn more about it. For one, especially with ketamine, you want to enter it with an intention, but hold that intention loosely. Because the second big tip is to not have expectations, but welcome everything. The intention can be a helpful guide as the ketamine takes effect to kind of help the system know what direction you'd like to go. Now, that might not be the direction that you need to go. And so what happens is going to happen. What's going to happen is going to happen. But having the attention can be supportive. Again, we want to hold this attention loosely and not have expectations, not judge our experience. Instead, we want to welcome everything. Welcome laughs, welcome tears, welcome even fear or anxiety that may arise. I really encourage trusting that the experience you have on your journey is the experience that maybe is needed in that moment, that there's something to learn from it, whether it was pleasant or unpleasant, exciting or disappointing. This is really beneficial to have this open-mindedness when going through this kind of therapy. It's also important to remember that a key aspect and component of psychedelic assisted therapy is implementing integration, meaning that the process isn't over once the effects of the medicine have worn off. It's important to give yourself time to really absorb and understand the after effects of what your brain has gone through, the neuroplasticity that you've experienced. It can be really helpful to journal in the following days, to give yourself time to really process your experience and again, the after effects before drawing any kind of negative conclusions. And of course, in ketamine assisted psychotherapy or other psychedelic assisted therapies, you want to talk to your therapist as well. So here's what happened in my experience. We were given blindfolds as well as a headset that played music that was sometimes more energetic and sometimes more relaxing. But we were able to create a really comfortable space. For me, having the earphones and the eye mask, and of course, the ketamine itself, really helped me to really go deep within myself. It was interesting. It was like as the ketamine was taking an effect and I was laying in my nest for the journey, everything became increasingly darker. Just darker and darker and darker. And I felt this feeling as if I was actually taking off, just kind of like shooting into space in a way. It's the only way I can describe it. I felt very connected to feelings of love and feelings of peace. As a spiritual person, I also felt connected to source in a way. I turned out to be a sobber on ketamine. Who knows if that would be the case if I got the treatment again. But my whole body became racked by full body sobs, and they did not stop for I have no idea how long. But I just let it happen. I allowed myself to feel the overwhelming feeling of gratitude that I was experiencing for having that experience. And I also allowed myself to feel the sadness of what my body was bringing up and releasing that I had been holding on to. Personally, as a spiritual person, I reached out to my higher self and I asked for support in working on the intentions I went into the journey with. Those I'll keep personal, but there were some certain messages that I did receive in the process that I will share in case it's beneficial for anyone or anyone's just curious. One message didn't apply to any of my intentions, but was clearly something that I was needing to revisit and work further on, which was the message that being on Earth, our experience on Earth, isn't about all pleasant, happy feelings. It is important to hold space for the difficult feelings, such as sadness, which again, I was really seeing in that moment was something that I needed to be holding more space for. I felt very encouraged to choose bravery and to do what I felt to be right despite fear from my inner child. I also received a reminder that it's safe to be seen. Just because it might not feel safe doesn't mean that it's not safe. And not always, but sometimes being seen is what's needed to be able to help certain people or maybe more people, as well as to be able to learn from certain people. We have to allow ourselves to be seen in some cases. And as an anxious, sometimes control freak, I received the message that the love that I was feeling in that experience, that's what really matters. And so even though I may also have love for people in my life and want good for them, it's not something in my control. And the best thing I can do is focus on that love, which is what matters, and let go and trust. Trust the universe that what needs to happen will happen. It's not in my control to begin with. and just focus on love. I recognize that some of the messages and lessons that I received on my journey may be difficult to embrace depending on your relationship with spirituality. And that's okay. This isn't to convince anyone that this needs to be, something for you to apply as well. It's just me sharing my journey. And part of my path is seeking to support those who struggle to reconnect with spirituality because of religious trauma. So my next video will be on how you can apply spirituality to live these lessons of bravery and safety and love and trust without religion. So hit the bell to get a notification. If you enjoyed this, give it a like and maybe share it with someone who may be interested or benefit from learning about ketamine therapy as well. Thanks for watching.